Hi, everyone. This is the lecture on middle adulthood physical that I had also promised to do for you. So let me share my screen. And here we go. Okay. So for middle adulthood, again, this is stuff from the finals of the previous lecture I sent you. This lecture, the one that we will have on Thursday, will also be included in the final exam. So physical changes in middle adulthood, we have, the aging process has started. There's very much a double standard in our culture here in the United States. Uh, Older women tend to be viewed in an unflattering way. Gray hair means you look old. Um, your face may have wrinkles. They don't look at that as, wisdom lines. It's like, oh, you're just like creepy skin, whereas men are perceived as more mature. It actually enhances their status. Their gray hair makes them look, you know, more experienced. Uh, Certain benchmarks that happen at this stage. After 55, the bones in general become less dense. Men tend to lose 1 inch in height. Women lose about 2 inches of height. More women actually develop osteoporosis. Um, this is when your bones are very fragile and brittle and thin, and this is also when we see people fall more and actually break an arm, break a hip, etc. Eating the right foods, things that are high in calcium. A lot of times they recommend supplements, but it depends on what type of supplement you're taking, because some of them are not very soluble. So you may be taking these calcium supplements every day, but you're only getting maybe a 10% benefit of it because it doesn't break down in your body. So you need to know what to take, when to take it, how to take it, and a little bit of research on that, or even just asking your physician can help with getting the correct answers. So taking something else or eating certain things, usually eating is better of the two. Men and women gain weight at this time period. Body fat increases in both men and women. Again, you can exercise, you can watch your calories. Some people are still going to gain weight, even if they watch their calories, even if they, you know, follow a nice, strict, healthy diet, not as many carbs, eating more protein, and they still may not lose weight. Doing 5 hours of exercise every day isn't necessarily good either. Um, Finding a balance between the two is important. Again, talk to your physician about it to be at the right physical level for your body in order to keep your weight down. That weight down will keep the weight off your knees and make it easier for your joints to move. So it's a benefit if you can kind of control your weight gain, but it's very common at this point if um, people do gain weight. Okay, so uh, you have to watch what you eat, how much you eat. Try to get some exercise at least 3 times a week. There are many exercises now online. There are indoor walking exercises. People who may have injuries or have issues with mobility. There are chair exercises, so you can keep yourself going. If you are limited in that way, though, you do have to do not only exercises, but do watch your amount of food intake there. Um, Back leg muscles, especially your back and your leg muscles, the strength gradually decreases for both men and women. We see back issues like stenosis, spinal stenosis, or herniated disc, can be very common. They can also be very painful. Sciatica, sciatic nerve. The pain runs down through your buttocks down into your thigh and can go all the way down to your feet. And it's almost like a severe cramp, and it can last for quite a while. There are, again, stretches that you can do. In a pinch, elderly people could take a swig of tonic water. Tonic water has quinine in it. Some people say the quinine can prevent the cramping or at least ease the cramping. Another one is pickle juice because of the high sodium content that also can help. But making sure that the person, especially if they are exercising when they're older, that they stay hydrated. Very, very, very important. Visual acuity declines once we get to middle age. The lenses kind of change shape, they lose elasticity, have a hard time seeing further away, or you have a hard time seeing close. Many people at this point, if they haven't worn glasses, now are wearing glasses, at least for reading, and many have a bifocal. Now, there are different types. You have the lined, they're a little less expensive, but uh, again, vanity of being older. We don't want people to know that we have a bifocal, so you can get no line bifocals, but they are more expensive. Vision at night, especially on nights where it's raining, and the headlights now are brighter than ever. So if you have oncoming, like headlights coming and you're on a highway, it can be very, very difficult to see. So a lot of people at this age start to plan when they're going to leave to try to go somewhere when it's more light out during the day, or uh, watch where they're traveling at night if they're having trouble. There are coatings that can be put on glasses, but once this pathway starts, especially people who may be getting a cataract, cataracts can be removed when they're ripe. But that process until then it could be very difficult to see. It's like putting Vaseline on your glasses and trying to look at and read. So it can be very difficult. Glaucoma, again, pressure in your eye. 1 or 2% of those over 40 are effective. Glaucoma can actually cause blindness. Hearing gradually declines in middle adulthood. We tend to use those higher frequency sounds prone to hearing loss, and loud noises. The hair cells change, the cilia in your ear, those three bones, the anvil and the anvil and the stirrup that help to have us hear. The eardrum itself just becomes less elastic with age. When we talk about reaction time, not everyone is slower, but there is a little bit of a loss of muscle control. So what may have been maybe a 4-second reaction time now takes 6. Or if you're more impaired, it might take 10. But it's just the beginning of that. It's not like complete loss of muscle and functioning. You can compensate by being more careful, or continuing to keep your body in shape. And then the muscle systems, the nervous system, circulatory, skeletal, psychological benefits. Sexuality, of course, in middle age continues. The amount of intercourse may decrease, but sexual activities are still vital. About half the men and women between 45 and 59 report having sexual intercourse at least once a week. Half the men, 50 to 59, third of the women have received oral sex in the last year. And again, it's just as important for gay and lesbian couples through middle adulthood and homosexual or heterosexual couples to, again, the interaction has to be wanted by both people that are involved. Again, sexual enjoyment, women don't have to worry about being pregnant, so at age 50, they tend to want or desire more sex because they don't have to worry about what's going to happen. They don't have to worry about taking birth control, etc. Most of the children are out of the home, so there's no freedom. You have more freedom. You don't have to worry about sneaking around. The kids are going to hear you. It may take men more time to achieve an erection. Ejaculation. Now, men can father children into their 90s, but there's less sperm. The sperm swim a little slower, so it's less likely as they get older. They may need to take pharmaceuticals, Viagra, Cialis, things like that, in order to retain an erection. Women's vagina becomes less elastic and thinner, which can maintain problems that women may have, that intercourse would be painful. Uh, there are creams and supplementals, um, some in pill form, some suppository, again, some just cream that can be inserted into the vagina in order to help to rebuild that elasticity. Of course, lubrication can be used so it's not painful. Women, again, tend to hit menopause. That's what, we think of as the average age. It can be a little bit before premenopausal, as young as 35. This is assuming there has been no surgery. But it can also go until like 65. But it's the end of your childbearing years. Uh, there you may start having less time during your period, only last a couple days versus a week. The type of fluid, more clumpy clots, things like that, are kind of a dead giveaway that you may be going through menopause. Production of estrogen, progesterone drop. You tend to have more things like hot flashes. There's extremes, like 1 minute you're like roasting, and literally 5 minutes later you are freezing. Dizziness, heart palpitations, achy joints, um, focus, you can lose focus. And then there are some people that have no symptoms at all, absolutely none. Um, when we talked about perimenopause, it can occur before this. That's typically because of hormone loss. Um, if you go a year without having a menstrual period, normally that is the mark that menopause has occurred. Um, you would still want to check with your doctor to make sure uh, that everything's okay and you've had your exams before you just make that assumption. Dilemma on hormones, hormone replacement therapy. Um, if you are having such severe, uh, side effects that it's affecting your life, then there are definitely benefits to having the hormone replacement. Um, you know, the estrogen does help with heart health, osteoporosis, prevents stroke, colon cancer, can help your memory. Of course, that's your sex drive. As that diminishes, there can be a real lag, but there are also risks with hormone replacement, breast cancer, blood clots, pulmonary embolisms, heart disease. Um, there are about 40% of women who started taking hormone replacement in the early 2000s, and then 10 years later, we found that had dropped because of all the possible side effects that can occur. Uh, it's scary to think that, you may take this medicine to solve some of your physical issues, emotional issues, but it could cause more harm than good. There's a drug Estratest, which is half estrogen and half testosterone. It's an older drug that has made a rise in being prescribed for people going through menopause. And because it's a balance between the amount of testosterone and estrogen, it seems to have less side effects. I'm not saying it has no side effects, it has less side effects. And you would always, if you're doing hormone replacement, go on the advice of your doctor and use the smallest amount. There are over-the-counter herbal supplements that have been beneficial. If you've had cancer before, you cannot do hormone replacement. Psychological issues that can go on because of menopause. It's very common during menopause for people to be, women to be depressed, be more anxious. Again, mood swings, crying spells, sometimes for no reason at all, something stupid like you spilled a cup of water and then you spend 20 minutes crying about spilling a cup of water. Hard to concentrate, so hard to sleep, irritability, again, mood changes. Uh, these are very, very common. Men, on the other hand, there is no physical thing like menopause for women. There is a period of time that we see this happening, usually starting around 40, but it can go over a long period of time. Some psychological changes, feeling uh, older, feeling they may not be able to perform their sexual work that they would want to perform normally. Uh, Prostate issues, 10% have enlarged prostates by the age of 40. By the age of 80, half of all men have had issues with their prostates, problems with urination, problems starting. They feel they have to go, but they can't go. They're just kind of waiting. Multiple times getting up during the night, having to go, and sometimes just going a small amount. Again, we talked about men still be able to father children into their 90s. And there are different things for erectile dysfunction. I mentioned the medications, but if you have heart conditions, since that can be one of the side effects of the medications, if you have heart problems, you're not going to be able to take Viagra or Cialis. And the review questions. Moving on to just general health. Many people at this middle adulthood, they're fearful of cancer. We still have no cure for cancer, of course. Some have no health problems and will go into old age with no health problems, but many do. Arthritis typically begins after 40, earlier if you played sports when you were younger. Diabetes, typically between 50 and 60, but again, we see that earlier, especially being overweight. High blood pressure, hypertension, more susceptible to high blood pressure as we get older. Death rate for people 40 to 60 has declined, less than half of what it was in 1940. And let's look at that. 1940, people were doing a lot more physical labor in factories that were dangerous. We didn't have some organization going in and make sure, like OSHA, to make sure the workers were protected. So that's when we have better medicines, we have better devices to do preemptive tests, like Cologuard for colon cancer, things like that, where you didn't have that before. Stress, still an issue, can affect both men and women, increase your blood pressure, hormone activity, things like cortisol is the stress hormone. So if you're under stress, cortisol actually can lower your way that your body uh, regulates uh, how it eats, its metabolism, insulin levels, and it affects your uh, white blood cells and your T cells that can help you fight off, any type of illness. Uh, we tend to pick up unhealthy behaviors like smoking, or we don't sleep as much, possibly because we're working, we have a family, or trying to do activities, have a life. You may be taking drugs, whether they are pharmaceuticals there that have been given to you by your doctor, or pharmaceuticals that you just decided you want to take and you buy off the streets when don't know what you're actually getting. People at this age tend to not want to go to the doctor, especially men. Uh, in general, women smoke less, but they do smoke. But for, the last 20 years, women smoking has caught up to men. They drink less. They have less dangerous jobs in general. Men tend to have more serious illnesses at this time. Um, Men issues and health actually have been studied more than women at this period of time. So there's quite a bit of research on men's health out there. Heart disease, more men die in middle adulthood of heart disease and circulatory problems than any other cause. You've heard of things like the Widowmaker, for heart issues. A lot of times it's genetic. It may run in the family. So if your parents had heart disease, there's a possibility that you may have heart disease also. So you should be checked often, at least once a year, for an annual physical. Men more likely than women to suffer, and that increases with age. Again, cigarette smoking, high fat or cholesterol diet, lack of physical exercise, all of these can add to the possibility of having heart disease. Type A and type B personality, uh, uh, choices. So the type A person is very competitive, very impatient, gets frustrated easy, more hostile. They are more susceptible to heart disease. Type A people want it their way, the highway. They'll work. They don't sleep as much. They don't eat right. They're just very constantly moving, and when they're tired, they get angry, get more hostile, can get themselves in trouble. Type B personalities are easygoing. They're patient. They lack aggression. They have half the risk of having coronary heart disease because they have lower blood pressure. They tend to relax if they're in a situation that causes anger. They walk away. Okay. Now, there's also research on a type D person. Um, there's not a lot of research on it yet. It's one of the newer things. So that would be type D behavior, people who are insecure, who have anxiety or a negative outlook on life. They tend to have a higher risk for heart disease also. Threat of cancer at this time period, in middle age, it's the leading cause of death. Many people do respond to treatment. 40% still live 5 years after a diagnosis. That's awesome. If you can make 5 years after a diagnosis, you got a pretty good chance of having a much longer life, but it's getting to that 5 years. Things that can contribute: poor nutrition, smoking, alcohol use, sunlight for like skin cancer, radiation, occupational hazards, um, radiation, chemotherapy, surgery, all three of those combined. When you talk about chemotherapy, you're basically giving something to a person that's causing horrible things to happen to the body. So sometimes people actually don't die from the cancer, they actually die because of the treatment. That threat of cancer, women should be doing breast self-exams, so should men. If men have breast also. Men should also do testicle self-exams, any type of abnormality, any type of lump please see a doctor. Mammograms are used to detect breast cancer. For the longest time, you had to be a certain age or have certain issues, but they've lowered that now. I believe it's women over 45. They recommend that you get exams and actually, continue to do that. Not necessarily every year if you're that young, but if you have a history of breast cancer in your family, then you should be getting a mammogram, uh, you know, fairly often. Um, most insurance companies will cover it, and there are people who cannot afford it. Many of the hospitals here in Pittsburgh, when they do the caring, I'm trying to remember what it's called, but it's down at the convention center. It's like every October where they will do free mammograms, free screenings. They'll give you a coupon for you to go to one of the hospitals, and it's free. So if you can't afford it, at least once a year, you can get that coupon to go to a hospital and get a free mammogram. And again, questions, and that's it. So that's our second um, of the filmed lectures that I have. We will continue with the lecture on Thursday, and have an awesome day.